Just a brief case study on the use of 5-fluorouracil for a intraepidermal carcinoma on the face. So an 83-year-old lady who's had a number of keratinocyte cancers excised in the past, but she's otherwise well. And she had this lesion on her cheek. It has been frozen once in the past. It wasn't sore, hadn't been bleeding, but persistent. And based really on a clinical diagnosis, this was called IEC, intraepidermal carcinoma, or Bowen's disease. It was just that fraction too large in size for a solar keratosis, and it was quite an isolated lesion. So I tend to find these intraepidermal carcinoma rather than solar keratosis for these single lesions which are a little bit larger in size. And there was no induration, so it didn't feel like a lump under the skin. There was no soreness of the lesion. All those clues towards squamous cell carcinoma weren't there for this lesion. And dermoscopy sort of reinforced that as well. There wasn't any particular clues towards squamous cell carcinoma on dermoscopy either. So after discussion, she decided she was happy with the idea of doing a topical therapy for this. Now, we prescribed the Tolak, the 4% 5-fluorouracil in the peanut oil, and she actually ended up using it 5 days a week for 4 weeks rather than every day for the 4 weeks. There was a little bit of concern on her part about amount of inflammation, so we made an alteration to her frequency of application as a consequence. And she did get the expected brisk reaction, but it wasn't too sore. It was quite tolerable for her. But the important thing I wanted to show was this. So she reappeared for her 6-month follow-up, and the lesion is gone. There's no scale, there's no roughness. She's very happy with the result herself personally. It's a nice thing. And then if we look at the dermoscopy of the lesion as well, there's good evidence of clearing of the whole lesion there. So all that scale and roughness that was going on there has gone. Now, we've discussed this with her. It's not completely out of the woods. There may be recurrence down the track, but I think the main thing is that patient's happy with the result, to the stage where she was happy to use the product on other solar keratoses. She's asked about that and said, "Oh, can I treat these other spots now as well?" She'll have continuous review for that every 6 months as part of her normal maintenance program for her skin, because she's grown other skin cancers as well. And so during that normal maintenance, we'll be reviewing this site on a regular basis. And of course, pointed out to the patient that there may be recurrence, that if she feels there's any thickening, any scale, any soreness of the area, could she please return earlier to assess whether there's any signs of a squamous cell carcinoma evolving in the area. Hope you found that useful. Thank you very much.